we understand the difference between UCODs and MCODs and why that is so important, I want to talk a bit more than we did in our last interview about the coding of the COVID vaccines on death certificates.
Okay.
You told me that there was a bunch of special ICD-10 codes created specifically for the purpose of COVID-19. And I can actually share that document that you showed me. So they were created to be used for COVID-19, and it turns out they are not being used. In fact, in the United States, when I tried to run a query for this code, U12.9, it wasn't there. Then I asked you, John, said, yeah, it's not even there. So they don't even have it in their database. There are no U12.9 deaths in the United States, not a single COVID-19 death coded according to the code that was created for it. And the same seems to be true at least in Germany and in Great Britain, because you said that there is some sort of literature where there's an asterisk under U12.9, and it says it's not really used much. Do you know if it's used anywhere in the world?
I don't know about the rest of the world, but the asterisk on both Germany and the UK's literature says that it's a subcategory of Y59.0. It specifically says
Correct.
that. Yeah. And
Yeah.
as that subcategory, you will likely find Y59.0 in both Germany and UK very sparingly. Like it's almost as if, Cornelia, they were told that if they ever write COVID vaccine on a death record, they'll get in a lot of trouble. And yeah, that's the message I believe that went out.
Let's see. I'm going to show you this here. Does this document, does this come from the WHO?
I don't know. Yeah, I can't tell by the slide.
I mean, it would have been the WHO that would have created these updates.
The originator is the WHO. Absolutely. What happens is the various nations, they basically copy the information from the WHO. I was saying that I don't know who made this slide, but the original information came from the WHO. Yes.
Yeah, that's what I meant. Okay, so here it says updates 3 and 4 in relation to COVID-19 coding in ICD-10. And then a set of additional categories has been agreed to be able to document or flag presentation for conditions that occur in the context of COVID-19, immunization to prevent COVID-19, and an adverse reaction to a COVID-19 vaccine. Okay, perfect. Both 3-character and 4-character codes have been defined to respond to the different levels of coding depth that is in place in different countries. So they even took care of that. They made sure that every country could code it correctly according to their coding depth. U12, here it is. And U12.9 is COVID-19 vaccines causing adverse effects and therapeutic use unspecified. And this code is to be used as an external cause code as a subcategory under Y59, which are other and unspecified vaccines and biological substances.
Yeah. So now would be a good time to explain to people the difference between hospital setting and death records. So in the United States, the death records all go, I don't know about all, but every state I looked at, which is many, they all send them to the CDC for coding. It's done automatically by software. If it makes a mistake or the software gets confused, it gets flagged for manual intervention, and then they manually code some of those. But in hospitals, that has nothing to do with the CDC. They have medical coders that work with the doctors. The doctors will tell them something, and the medical coder will write down the right ICD-10 code. And so I have been told by doctors that on living patient records, they have used U12.9. They have seen it. They have used it. That's anecdotal, but it has been told to me. On death records, 0. In fact, if you go to the CDC website, you will see no mention of U12.9. I did a search of CDC all through their website. I cannot find U12.9 anywhere. And so the CDC did not pick up the code from the WHO. What you just saw is the WHO created the U12.9 for COVID vaccine poisoning. that cause something to happen bad in a human body. It's not used.
Right.
It's not used. And Cornelia, when I testified in New Hampshire to support a bill that I had written, and then right after me, they had the chief of the Bureau of Statistics of New Hampshire in the Department of Public Health and Human Services of New Hampshire testified after me. The first thing she said was, I asked my staff to tell me of anybody who died from COVID-19, and I told them to look up U12.9, and we have 0 deaths from COVID-19 vaccine.
Correct.
I'm like, of course you don't, because you looked at the wrong code, and you're the chief of Bureau of Statistics of New Hampshire. You don't even know what you're looking at. So the single point of
Well, she actually looked at the right code. It's just not being used.
it's not. Don't you think you're right? You're right. You got me.
But I mean, yeah, she did exactly the right thing. And if you don't know any better and you look up, oh yeah, there we go. I mean, I just showed it. That code was specifically created to record COVID-19 vaccine, adverse vaccine events, right? And she is quoting exactly that code, and there is 0. And in fact, in the entire United States, there are 0 of such deaths. So we don't have a problem, do we? I mean, it's so deceptive. It's just unbelievable in its brazenness to not use that to create the code and then just not have it. It's not even listed in the CDC Wonder database. It's not there. It doesn't exist.
Right, and in her case, it's not purposeful. If you saw her testimony, you just know she's.
Well, of course,
she's not.
of course
she's
not.
just doing her
But
job.
it gives her an easy way out. It gives her an easy way out for anybody, because then if she had said that to someone who doesn't know any better, I mean, you knew better, but anybody else would have just been said, oh, how can that be? Well, I guess, there would have been complete confusion, first of all.
Yeah.
And the media could have picked it up and run with it and said, look, here we go. There's even a code for COVID-19 and not a single death recorded under that code. So what are you all talking about?
So, I mean, my career and everything, I'm really more of a systems engineer, systems analyst than anything else. And in the system of these coding and tracking data and everything else, I can point out all the flaws in human behavior in the system. But here's the biggest problem with the deaths. The CDC is a single point of failure for the entire United States. New Hampshire is completely 100% reliant on the CDC to tell them how somebody died. They have medical examiners and doctors in New Hampshire who write words on death records. They go to the CDC and they get coded and they come back and this woman says, we don't have any COVID deaths. And she's the chief of the Bureau of Statistics of the Health and Human Services Department of New Hampshire. And she doesn't even know that another code or a whole bunch of codes like Y59.0, T88.1, they exist for coding that represent a COVID vaccine death. She didn't look because she doesn't know. It's her job to know. So she's incompetent. She's not nefarious. CDC is nefarious because they set up the system and they know that there are a lot more deaths than they're telling the people through data. CDC is the nefarious single point of failure, and not just failure, but purposeful misrepresentation, purposeful false data.
I think it would be a good idea if these death certificates would not be sent to this facility run by the CDC, but to each state should do it, and then they can send the resulting data onto the CDC. But that should really be done by the state. In Germany, by the way, that's the way it works. So Germany is federal, like the United States. And the death certificates are also, they are not coded by the doctors, just like here. They are sent to a central place in each state. So for example, I'm from Hamburg, which is a city state. So a death certificate in Hamburg would be sent to the health authority of the state of Hamburg. It's a city and a state at the same time. Would be coded there, and the same is true for all the other states. Let's say in Bavaria, they have their own coding. They do the coding of the death certificates. I don't think it made any difference in Germany, by the way. I think they just have the same problems and probably lie about it. But still, it gives you another layer, and it would be much better if it weren't as centralized as it is here. Now, there is this 159.0. tell me about this code, John, what it actually is, what it is meant for. We have already seen that this 12.9 code was a subcategory of Y 59.0, and why 59.0 ended up being used instead of this U 12.9 code.
Okay. With a lot of these codes, there's the generalized category if they don't have specificity associated with the cause. I'll give you an example before I do Wi-Fi 9.0. So J18.9 means pneumonia unspecified, because a lot of times they just write pneumonia on the death record. They don't write whether it was viral pneumonia, bacterial pneumonia, or fungal pneumonia. And if it's bacterial pneumonia, there are subsets of those codes. So I think J15 is bacterial, and J1 5.0.1.2.3 and so forth, Staphylococcus, Streptococcus. There's different bacteria that caused the pneumonia, and they found that out through microscope evidence from the sputum, and they know, they can figure it out what type of bacteria it is. That specificity doesn't generally get to the death record, and if they don't write bacterial pneumonia and they just write pneumonia, it gets coded as a J18.9. More than 90% of the pneumonias are J18.9, and then you can track J12 viral and J15 bacterial. So now let's talk Wi-Fi 9.0. All it means is viral vaccines. So COVID is a virus, and COVID vaccines are viral vaccines. So if you
mRNA isn't, though. That's not a viral vaccine.
Well,
first of
it
all,
depends on how you define viral vaccines. It's what is the target that you're trying to vaccinate against? It's a viral disease. So it's not a viral vaccine. It actually kind of is, because the genetic coding in that mRNA is part of the virus coding, the RNA from the virus. So, but
well,
it
I looked up the definition for viral vaccine, and that says it's a vaccine that contains an attenuated virus in order to immunize the person against the disease. And that's just not the case in the mRNA COVID shots.
So when you looked up the definition, was it a general definition or a legal definition defined in a document specific to the WHO for the Wi-Fi?
It was a general.
Yeah.
I didn't go
Okay.
that far. No, it was just a general definition.
So words have meanings in legal documents different from the colloquial or general dictionary use. Things like provider. If you look up provider in the dictionary, you're going to get a very different definition than if you look up a law that talks about the provider has immunity from being sued, where the provider in that case is defined as a doctor, nurse, psychologist, social worker, chiropractor, and there's probably a couple more that I missed. So words have different meanings in context, and I would say you're going to have to go to WHO and look up the meaning of viral vaccines in the context of Wi-Fi 9.0 as put out by the WHO. So it's the one that's supposed to be used. And if anybody out there in the land listening to me can tell me I'm wrong, go ahead, because guess what? There's 272 in the United States that say COVID vaccine, and we're coded with Wi-Fi 9.0. Even though Dr. Sarah Meyer went before the ACIP committee and told them, we only know of 6 TTS deaths from the COVID vaccine. She lied.
So let's have a look at that. Actually, let's have a look at the data. And I guess when it comes to the definition of viral vaccines, you must be right, because otherwise, I mean, who knows how they define it, but they apparently define it in such a way that it covers their mRNA shots, because they coded the U12.9 COVID adverse event death for COVID vaccine adverse event death under Y59.0. Okay, so let's have a look. Oh, before we have a look, I want to ask you this. You talked about legal definitions, and I remember from an interview with Sasha Latipova, she told me that the legal definition for vaccine is kind of very rudimentary to non-existing. She said there is no real legal definition of a vaccine. It's more like a use case. So if you say a gun can be used to vaccinate somebody, you can just say, okay, a gun can be the use case of a gun. If we define it that way, that it's a vaccine, then it's a vaccine, as extreme as that sounds. She said there is no real proper legal definition of a vaccine.
All right, two things. One, that there was a legal, it depends on which legal document. Each document should define the meaning of a word in the context of that document. And so I can't say broadly what Sasha said. She didn't say anything wrong. But broadly, in dictionaries, they changed the definition of vaccine. And I believe they did it so that they could legally use it, because if there's no definition within the document, it defers back to the colloquial or forget about colloquial. Common usage. Common usage
Yes.
is what it goes back to. And they did change the definition of vaccine in order to call the mRNA shot a vaccine. And I wrote about this over 3 years ago. People would not have taken a new gene drug therapy. They had to change the definition because the word vaccine is accepted by people as a good thing in most of society. And they believe that if they're being vaccinated, they're being protected. And so because the word already had an association of protection in the public sphere, they had to use the word. Had they used the word new gene drug therapy, people would have said, well, wait a minute, you're messing with my genes? There would not have been an accepted feeling about it. So it's a psyop to call it a vaccine. They also changed the name of the word anti-vaxxer, which I didn't even know was a word. But it was,
I didn't know that.
Oh yeah, it had
tell me.
Yeah, it had a definition of people against all vaccines, and they changed the definition to be people against any vaccine and people against any policy that the government puts out with regard to any vaccine.
Oh, okay. So we are all so then we are all anti-vaxxers.
Exactly. They made it so that anybody can be called an anti-vaxxer. That's how much they changed the definition. Now, the other thing that you mentioned, if a doctor wrote on a death record, and this did happen, under the causes of death, COVID-19 shot earlier in the day, COVID-19 shots. They got the COVID-19 shot. You know what that was coded as? A gunshot wound.
No.
Because the software picked up the word shot and coded it as a W. I forget the extension, but it was a W. It's a gunshot wound. Died from a gun. It was coded as listed as died from a gunshot wound. How many?
So that's what the parser did with the word shot.
Yeah.
Well, that's a pretty dumb parser.
Yeah.
So there must be a huge increase in gunshot wound deaths then.
What kind of death certifier writes shot instead of vaccine or vaccination? You could go the other way.
Well, apparently some do. But I mean, if it says COVID-19 shot, if it says COVID-19 right in front of shot, then the parser cannot just take the word shot and not look at what came before.
It did. It did. It's Minnesota. It was in Minnesota.
Crazy. So, but let's have a look at these numbers. So the Y59.0, that's the one that was used to code for COVID-19 adverse. So let's have a look at this. Oh, actually, we can look at this one first. This is Y59 from 1999 to 2020. It gives us a nice context to see how many we find in these years.
Yeah.
And so if I scroll down here, you can see ICD-10 codes Y59.0 viral vaccines grouped by year. Show totals. Yep. Zero values true. So zero values are shown. The suppressed values are shown as well. Suppressed means anything equal or smaller than 9 incidences is suppressed for privacy purposes, and calculate rates per 100,000. Okay. And here we go. So in 1999, so there's lots of zeros. You can see that immediately. Lots of zeros. Couple of suppressed, so it's 9 or smaller. So it's between 1 and 9 when it says suppressed.
You have the total at the bottom,
and the total is 11.
There you go. So all those suppressed, 1, 2, 3, 4, 5, 6, 7, 8. There are 9 there. So at least one of those is more than one in a year. It's probably there's 1, 1, 2, 2, 1, 1, 1, and the rest are 1 probably.
Yeah.
But
Yeah.
11 total in all those years.
So almost none. So 11 vaccine deaths in 21 years. 11 vaccine deaths. If that's just mind-boggling, right? 11.
Yeah.
In 21 years. If you compare that to the data that is actually also in the Wonder database where I ran this query, when you look at the VAERS data, then you find completely different numbers. This is completely ridiculous.
Well, let's just remember, everybody remember 11 in 20 years. 11 in 20 years. I think it's 20 years. 9 to 0.
Yeah.
11. Now, do you have 21 through 24?
Yes, I do.
Here we go.
So this is let's have a look at the criteria to make sure. Yeah, so these are again, Y59.0 viral vaccines. Everything else is the same. And then it's from the years 2018 to 2023.
Yeah.
But is this, let me see, I want to make sure this is.
We'll have to figure out what's different between yours and mine because I got.
No, I know why. Because here I wanted to show, this is underlying cause of death.
That's why.
I have both. I have underlying cause of death and I have multiple cause of death. So let's have a look at underlying cause of death. And now we understand what that means.
Right.
It's whatever is found in part 1. If there is something on line D, it takes that. If there's nothing, it takes C, B, or even A. If there's nothing else, then A. And this is the numbers we find here, 85.
So 85 doctors or medical examiners or coroners did the right thing. They put it under the UCOD. Yeah, that's 85 put it in the right place on the death record. I mean, I can tell you right now, the number's probably, the MCOD is 272, I believe. But
yeah, and we'll have a look at that in a little
the most important.
I just
don't go back to the other.
I just
one. Go back.
Oh yeah, this one here that I showed first. This is also underlying cause of death, so that we can really compare it. So here we had all these years with 0, 0, or maybe 1 or 2, and now we go to the year 2021, and all of a sudden it pops up to 66. 66.
Yeah. Now bear in mind, the CDC sent their director of one of their groups, Dr. Sarah Meyer, a pediatrician, who wore a uniform akin to a Navy uniform because they call themselves the Medical Officer Corps. It's really strange. I don't know why they wear a military uniform to present to the ACIP committee, but
they probably belong to the military.
No. They call themselves the Medical Officer Corps. And they've adopted uniforms, I've read about this, similar to the Navy Department. Because I was like, that looks like a Navy uniform. It's missing a lot of stuff. It's missing some rank.
Oh, I see.
It was weird. And I was like, but it looks like a Navy uniform. And I looked it up, and yeah, they modeled them after the Navy. Anyway, her presentation said, we only know.
Well, it's all about authority, John. Yeah. Because, I just said, oh, well, if she wears a uniform like that, it's probably, I mean, I wouldn't even have noticed the difference in all likelihood. I would have just said, oh, she must belong to the military.
Exactly.
Like military
and
uniform.
She must be an honorable military officer. No, she's a lying doctor from the CDC who lied and said there were only 6 TTS deaths, which means thrombosis with thrombocytopenia syndrome, TTS, and only from the Johnson & Johnson. That's the limited hangout of the tip of the iceberg above the water that they tell you about. And here's what's below the water that she's lying by omission and not telling you about. They know of far more than the 6 TTS deaths from the Johnson & Johnson vaccine, because here they are in their database.
Mm-hmm.
And these are just the underlying. We can go to the multiple cause because the number triples.
So here they have the 66, but now let's have a look at, so as I said, this is underlying cause of death, 2018, 2023. Now let's look at multiple, how that changes the data. And I think, what's this one? This is something now. Oh, this is something with, this is N17. This is N17. So okay, fine. Then I'm just going to run it, and then people can see how this is done. It's actually, I find it's really fun to do this.
Yeah.
You can spend your whole life in
grab
this thing, and you
grab
can.
a couple of beers and sit there and play with CDC Wonder.
Yeah, honestly, I like doing that, and you find all sorts of wondrous things. I can tell you that. Well, I don't have to tell you that. You know that very well. Okay, so here, this is the. Is it possible to see this? So this is the CDC Wonder website, and if you go, you see here all ages, and then under there you see underlying cause of death and multiple cause of death. So I just showed the data for the underlying cause of death for the Y59. Now let's go to multiple cause of death and run exactly the same, but as multiple cause of death. And the nice thing is that when you do multiple cause of death, you get all the years up to now. You know, it's interesting. Why is that? For underlying cause of death, you only get to 2023, but here for multiple, you get to last week. Do you know why that is?
You scroll down a little bit. Just right. Stop. Nope. Go back up a little bit. See that? I want to have them both. There you go. There's two different queries. One looks at the 2018 up to present, and you showed that with the underlying cause of death. It's the same thing. But you showed that. Remember, there were two. You had to show two different screens. One was 1999 through 2020, which you now see in the bottom here, 1999 through 2020. The other,
Yes, that's right.
and then the other one
But I
was
don't.
just 2018 through 2025, or up to last week, 2025.
No, only to 2023. Look, it doesn't give you the other data. Where is it? The underlying cause of death. See, that's all I get.
Oh,
They don't give you. Yeah, they
oh,
don't give it to you.
I wonder if you ran the middle one there instead of the top one.
No, I didn't. I ran the top one.
Okay. Oh, that is interesting.
It's weird. It's weird, right?
Yeah. No, I didn't know that because I don't use underlying cause of death.
So it's way more restricted what you can do when you pick underlying cause of death.
Yeah, I don't use it, so I didn't know that.
Yeah.
I never use UCOD. Haven't done it in 3 years. It's a waste of time.
Anyway, so if you use multiple cause of death, then you get 2018 to last week. So you click on data request, and then you have to sign this.
It's on the bottom in the middle.
This some sort of well, you have to data use restrictions. Okay, I agree.
You basically promise that you're not going to identify anybody if you do that.
Yeah. And then so now there are all sorts of things you can do here where how you can pick your data, what you want to look at. It would be nice if they would just give you the database, the whole database, and you can run your own queries. Or they should do that in addition to this, I think. But you always have to go through this layer. You always have to run a query. Using their stupid query system, and it's very clunky. So here we pick the year. We want the year. We want it by year. And that's really all we want for now. And then we want all the states. So we leave this, all states in the United States.
Yeah, not residents. If for people listening, if you were to select your state, don't do the residents here. Scroll down a little bit and you'll see another selection. I would use this one because this is everybody who died. So if you live in a state where there's a lot of tourism and people die or whatever, you want everybody who died in the state because that's the death records. So do the occurrence states, not the residents.
Okay. And then the demographics, we want all demographics, all ages, everything. So but you can, if you're interested in just like 5 to 14, you can pick just those. If you're just interested in male or female, if you're interested in Hispanic, they single out Hispanic origin here, all sorts of race stuff. You can do all sorts of stuff. Okay, select time period of death. I want it all. I want all the dates, all these years from 2018 to 2025. Select autopsy, place of death, all values. And then you come to select underlying cause of death. I didn't do that. I didn't. That's actually interesting. I could run that too. Do that one and the multiple cause of death. But we are just doing select multiple cause of death now, which is here. I leave it at I want to see the ICD-10 codes. So then you go over here, you click on search, and I'm just going to search for for Y59.0, and here we go, viral vaccines. And then you move the item over. It's very clunky. You move it over to this window here, and then you scroll further down. You show 0 values and suppressed values. If you don't click that, you don't get any data for that. It doesn't show you those values if you don't click it. And then you click send. All right now. Okay, so here we go. And this is that's provisional. The last 2 years are provisional, and 2025 is provisional and partial. So here we see in 2021 195. Yeah, which and in the other one it was 66. So this really illustrates your point. Here it picked up wherever it found something that it could code as a Y59.0 on the death certificate. It didn't have to be in part 1, row D, and we have way more here. 195. It's still just a trifling. It's almost nothing. The crude rate per 100,000 is 0.1. But you can see that it's considerably more than it's for the underlying cause of death.
Yeah, I mean, what you see there is 3 times the number that was on the other screen.
Yeah.
On the underlying. So you also see a number that is far bigger than the 6 that Dr. Sarah Meyer testified to. She testifies to 6. That's all they know about. Well, you're looking at 282 right here on the screen. And they all started in the year of COVID vaccine.
Mm-hmm. Mm-hmm.
And you know what, Cornelia? I want to run the weekly on this. I want to see in 2021, when did they stop? And it wasn't that the people, don't get confused, everybody listening. When the data stops, that doesn't mean the actual thing that caused it stops. That means they stopped collecting data on it. They told the medical examiners, do not ever write COVID vaccine on a death record or you're fired. And so the first one in Massachusetts that was written with COVID vaccine was coded with Y59.0. His name is Solomon Kizito. He was 60 years old. He died from acute bronchopneumonia in the setting of thrombocytopenia in a person recently vaccinated. That's his death record. It was coded. And then Diane Dubois, acute intracranial hemorrhage in the setting of thrombocytopenia in a person vaccinated 11 days prior. That was not coded. And that was March. So Solomon was January 16, 2021. Diane's was March, not coded. Brianna was April. Brianna McCarthy. It says COVID vaccine now. It is finally coded, but it took 3 years to tell them to code it. Eden McDonald was 17 years old. 17. And I know she reacted to the vaccine and died from CVST, cerebral venous sinus thrombosis. Not coded. Amaya McDonough Rocha died from a cerebellar tonsillar and bilateral uncal herniation stroke at 12 years old. Not coded. And I could go on. But the point is, somebody told them to not write COVID vaccine on death records. And so this 195 is likely reflective of medical examiners and doctors starting to do their job and write that the COVID vaccine caused the death. And then somebody told them to stop. And now you see 2022, there's only 47, and then it goes down to 12 and 20. They learn very quickly that they're going to be in a lot of trouble if they write vaccine on a death record.
When you look at this number, 195 in 2021, when most people got their 2 basic shots, and fewer people got the boosters later in 2022. When you look at this number, it becomes clear that almost none of the deaths that were caused by the mRNA COVID shots were properly listed on the death certificate. Almost none. And to make that clearer, I want to show the data from Albert. Apparently, it was some sort of an act of resistance to write that somebody died of the COVID-19 mRNA shots on the death certificate. That's how I read this graph. It was like, I'm going to write it down anyway, even if nobody else does it.
Yeah. Yes.
And then it goes down in 2022. It makes sense because there were way fewer people got the boosters. Also, the greater the time, the elapsed time between the shots and the death, the harder it is to prove that it was caused by the vaccine. And that's why it's so important to look at the excess deaths, because that will give us information about the correlation between that. And we'll do that in a little while for the renal failures. But
the direct testimony lie, the misinformation, the disinformation, the false representation, which is a federal felony that Sarah Meyer made, is we only have 6. There's 282 there. Now, I think the last thing you need to show here is MCOD for the years 1999 through 2020. Let's go show how few there are, because we didn't do the MCOD for that.
The multiple causes? Yeah, sure. Let's do that too.
Yeah.
And then I'm going to go, I don't want to forget to go to Albert and show the data, the death data that he has in his VAERS-Aware database. All right, so let's do this again. So we are going to multiple cause of death. There we go. And we are going to
third one down.
This one here.
Yeah, this is good. I just want to make sure people know that the 282 in just basically that was starting at 2021. It had a couple of suppressed numbers in 2019 and 2020, which were like one.
Ooh, look at this.
So we may not be
Can't currently handle this request. Well, I looked at that before, and the numbers were, I don't know, they were also just very, very,
it's 15.
Hardly anything.
It's 15. The number is
15.
Okay,
so
I could tell people the number is 15 from 1999 through 2020. So you have, from 2010. I ran it from 2010, not 1999. So there's a few, it might be a little more than 15, but.
Okay, so and here it was 11. So
yeah, so from 2010 through 2020, the number is 15. So for the 10 years leading up to COVID, it's 15. And then in the year of COVID vaccine, the first year, it's 195.
Yeah. These extremely low numbers in the 20 years before COVID, that also shows in a really impressive way that doctors do not put down on death certificates that people died of vaccines.
Yeah.
They don't.
Yeah,
they just don't.
If I were to wager a guess, I would say that medical examiners know they should never write vaccine, and they've known that before COVID. But when you have doctors who had people die while they were attending to the person and they write the death record, some of them probably wrote, oh, that's a COVID vaccine death. They're probably just an honest doctor who rarely fill out a death record, and they wrote it. There it is. And then they were told, don't ever write that again.
It could also be, the kind of work that you have been doing that hasn't been done in all these years. Nobody was doing that. So how do we even know what the parser did? It is very well possible that the parser has instructions to turn something that says something about death caused by vaccine adverse, into something else.
Yeah, no.
Into another code.
I'm glad you brought this up, Cornelia. Let me straighten this out. The ones that were coded had the same words as the ones that weren't coded. So if the parser is reading it and coding it, somebody went in and deleted it. After the parser spit out Y59.0, somebody was deleting them. The only other plausible explanation is it doesn't code any of them, and they manually coded the one for Solomon Kizito in Massachusetts, for the 3 in Minnesota that are coded, but not for the next 6. For the one, Michael Williamson in Connecticut, 16 years old, died in June of 2021. His is coded by the chief medical examiner of Connecticut, who is Dr. James Gill, who wrote a paper about it. Everybody knows about the 2 teenage boys who died of myocarditis. One of them is Michael Williamson. He was 16 years old. He was, I believe, visiting his father in Connecticut, really lived in North Carolina. I could tell you about him because I have the full record of him. Now, he's coded the next 3 or not that mentioned vaccine. If it's an automated system, if it's software that automatically codes, then somebody deleted Y59.0 after the system coded it. So you have federal felonies happening regularly all across the country based on what the CDC is doing. If it's not the software that's coding it, then there was manual intervention in the beginning of 21, and they stopped doing it altogether. No more manual intervention.
Yes. Exactly. And you found that out when you looked at the data
Either way,
during.
it's purposeful. And either way,
Yeah,
it's a
for
federal
sure.
felony.
Mm-hmm.
These are felony crimes that are being committed every day by the CDC.
Yes. So what I'm saying is we don't really know who is doing what here. We don't really know how many doctors put vaccines as cause of death on death certificates, whether it's really these numbers or whether way more numbers go to the CDC, maybe are parsed correctly, as you said. But even if you could say, okay, the parser parses the death certificates, and then somebody looks at the results and might find, oh, wow, there are way too many vaccine deaths. There are way too many Y59s, and you can just run a software over it and change all these Y59s into something else. That's easily done. And since nobody did the work you did looking at the death records when they came back from the CDC, we wouldn't know. I mean, we don't know.
Yeah,
Correct?
all I can do is extrapolate from the 3 states that I have. And so if you look at
Yes.
the 3 states that I have, 3 in Minnesota, 2 in now 2 in Massachusetts because they finally put it on Brianna's, and then 1 in Connecticut. That's 6, and that's 1/50th of the population of the United States. No, sorry, it's 1/20th, 4.9% of the population of the
Mm-hmm.
United States. So multiply the 6 by 20 and you get 120 right there. And those are the ones that are coded. And if you look at the ones that the total, right? The total is 20, it's 20 something. It's not 6. So it's 3.5 to 4 times more. So take the 182 that you just discarded, 282. I know I'm spewing out numbers. Okay, for the audience, the number was 282 at the bottom of multiple cause of death. If you remember, 282.
Here we go.
Multiply that by 4, right? And you're over 1,000. You're easily over 1,000. And the difference here that I'm talking about are the ones that are written as vaccine in the cause of death, but not coded versus coded. The ones that are coded is 282. If you take the example of Connecticut, Massachusetts, Minnesota, for which are the only 3 states I have the actual records, if you take the ratio of coded versus not coded, where vaccine is listed as a cause of death, take that ratio and apply it to this 282 number, and the number is well over 1,000.
Right. And now let's compare that to the data in VAERS. So I'm going to switch over to VAERS. This is from Albert Benavides and his VAERS-Aware database. Yeah, I'm just going to scroll up to the top here. You can see this is the entire master dashboard by Albert. And I scrolled down here to show this. So let me see. Where was that? He has all sorts of data here. So if you look at this one here, this is a really good one. It goes all the way back to 1990 to 2025. And you can see here, look at this.
Are these death?
So, and it's, no, it's not all death. So you can, if I hover over it, can you see that? If I hover over it,
No.
well, that's so interesting. It doesn't work. It doesn't work when I share my screen. It works when I don't share my screen. So the green one is office visit. Okay. Office visit. And then this is, I think, hospital, some sort of hospital visit. And then it becomes more and more life-threatening. I think blue might be I think blue is permanent disability, and this orange here is life-threatening. The red is the death. You know what? I'm going to run it so that I can tell you the numbers. I'm going to quickly do it on my monitor here because there I should be able to hover over it and see the numbers. And then I can tell you what they are. I mean, you already get kind of an idea because this year is 1,000K. So this is the 1 million mark here down here.
Yeah. So there's been over a million reports, of which the red is the number of deaths in those million.
Okay, so we have. Let's go to red. The red tip is death. So we have almost 23,000 deaths reported through the VAERS system in 2021. Now, that is all vaccines together, but if you compare it to the year 2020, you get an idea what proportion of these vaccines would have been the mRNA shots.
Cornelia, we don't see what you're reading from. Just saying.
Oh, sorry. So yeah, so I'm looking at this little tip here, the red.
Yeah.
These are the deaths from vaccines in the year 2021. Can you see this one here,
Yes.
right?
Yes. Yeah.
Okay, good. So these are the deaths, and if I look at the number on my monitor, it's 23,000 are hidden in this little red
Okay. So in the just that 1 year,
rectangle here.
2021, just that 1 year, it's
Yes,
23,000, where
correct.
282 out of the 23,000 were coded, and about 1,000 were written on the death records. So we're looking at ratios here, and the ratios
Yeah,
of, what's reported to VAERS is greater than, what's reported in death records, which is greater than what's coded in death records.
exactly. So when you look at this blue part here, this means permanent disability, and that number is way larger than the deaths. That is almost 40,000 people permanently disabled in that 1 year by vaccines, and most of these cases would have been from the mRNA shots. The orange, that is, let's see, the orange is life-threatening. The life-threatening is another almost 40,000, 37,580. And then the brighter orange here is, what is that? That is hospital. So almost 100,000 people had to go to the hospital in connection with the shots. And that's just the year 2021. 2022, we have, how many deaths do we have in 2022? We have 12,570 deaths. And we have way more permanent disability. We have almost 26,000 permanent disability here in the year 2022. Yeah. And just, look at this, look at the difference between the years,
Yeah.
Okay.
But there's our enemies, those who wish to kill us with vaccines and hospital protocols, the government. They would make the excuse that it's a passive reporting system, anybody can report. Well, it's a felony to report erroneous information purposely. People are not reporting this, but on purpose erroneously. Very few of these are errors. But what happened in 21, I would say, because of COVID, and we haven't had a pandemic in a long time. In fact, there can't be a pandemic, and COVID was not a pandemic by the definition of a pandemic. But people became aware of VAERS, not to be confused with Albert's site called VAERS-Aware. People became aware of VAERS in 2021 due to the fact that there's a COVID vaccine, and it was the biggest thing to happen in the history of the country with regard to disease. And so our adversaries would say, well, what you're seeing is a reflection of doctors becoming aware of a system they did not previously know about. That's why the most important part of VAERS is the individual records. And I've correlated individual records with death records to identify people, which if they want to come and arrest me, they can arrest me. But if they want discovery in a case for arresting me for identifying people, in that discovery, it will be shown that the CDC has been committing felony fraud the entire time. All the discovery is going to come up.
That's why they're not going to arrest you.
Well, let's hope they don't. But just this video alone shows that I have knowledge of what I'm doing. I can't say I am not innocent of it, but I'm doing it. It's in defense of others. I've saved many lives by telling people the information, and I could have those people come forward as expert witness, or not expert, but as witnesses to say, I didn't take the vaccine because what John said was true from official records. And they saved my life because I would have taken that shot. So defense of others is a good defense I have. But anyway, the point is that using VAERS for statistics is a very difficult thing to do. You don't know the denominator. You don't know how many people are reporting. And they talk about an underreporting factor. And that's kind of, I don't like to use the word, but it's a waste of time, because the underreporting factor for death is different from headache. Of all the headaches that happen from the vaccine, there's going to be a different ratio of underreporting for headaches than it is for death or for stroke. It's also going to be different in Kentucky than Massachusetts. Because in Massachusetts, if anybody finds out that you reported to VAERS, then Massachusetts runs on health. The entire economy of Massachusetts runs on COVID. All the buildings that are being built by Mass General Brigham, a $20.6 billion corporation, that's the revenue they do each year, 3/4 of which comes from the state and federal governments. Everything to do with COVID came out of Massachusetts. You don't have time for me to go through that. I think I did it on your last podcast.
Yeah.
But the point is, in Kentucky, the doctors have a lot more freedom to report to VAERS because their careers won't be over. So you have, Kentucky has a lot more COVID deaths. They must have shipped really bad vaccines to Kentucky. No, I don't think so. I think what happened was Kentucky doctors are free, not free, but far more likely to be honest and to report to VAERS. And in Massachusetts, the culture is that don't ever report to VAERS. You're in trouble if you do.
Mm-hmm.
So that's a big difference.
John, you said something interesting about the underreporting factor, that it's going to be dependent on the adverse effect. If you have a headache or a sore arm, well, who's going to report that to VAERS? Nobody, almost nobody.
You'd be
very few people. But yeah, but if it's something like death, then most of the reports are filed by medical professionals, so doctors, nurses, etc. If it's death, then the chances are much higher that there is going to be a VAERS report. So the underreporting factor is going to be lower. We don't know what it is, if it's 20 or 30 or we have no idea. But that there is an underreporting factor, that the numbers are higher, that is without doubt true.